Hello everyone, how are you? In this class, we are going to discuss about the drugs for amoebiasis. I think it is very better to talk about one drug daily. That will be very efficient for studying and learning purposes. Today, I'm going to discuss about the metronidazole part, only the metronidazole. We know that the drug of choice for amoebiasis is only the metronidazole. So, coming to the classification of drugs in amoebiasis, we have three types of drugs, and causative agent of the amoebiasis is entamoeba histolytica. Okay, see the screen. And the three groups of drugs, the first drug is tissue amoebicides, which will act only on the tissue that is outside the other than the intestine, that is extra intestinal, that means liver. So if liver abscess, amoebic liver abscess, it acts on the liver only. So the drug which acts only on the liver, only on the tissue, that is always chloroquine. Only the drug we have is chloroquine. And next component is the drug will act both on the intestine and also extraintestinal liver. In this case, we have a lot of drugs. One is the main family, that is nitroimidazole family. We have metronidazole, we have trinidazole, we have secretidazole, we have ornidazole, and other drugs we have emitin and dihydroamitin. For severe amoebiasis infections, we are giving intravenously these drugs, emitin and dihydroamitin. And coming to the last group of drug which acts only on the intestine, that is luminal amoebicides. We have diloxanide furovate, we have paramomycin, we have iodine drugs like iodoquinol, quinidochlor, and tetracyclines. So now I am going to talk about only the nitroimidazoles today. The most commonly used drug is metronidazole. So these drugs are effective orally as well as intravenously. So it can be given orally as well as intravenously. And most of them are metabolized by hepatic metabolism. They are metabolized in the liver. So what is the mechanism of action of this nitroimidazole? If you talk about that, in that metronidazole, there is called nitro group. There is nitro group in the metronidazole. It will get activated by the process of reduction. By the process of reduction, it will form a reactive radicals called cytotoxic products, and that reactive radicals will damage your DNA of the bacteria so that the amoebiasis will die. It will damage the DNA of the amoebiasis, so the amoeba will die. So I will repeat once again: the nitro group of the metronidazole group. Okay, the nitro group will get activated by the process of reduction. In this reduction, it will form reactive cytotoxic products. It is equal to free radicals that will damage your amoebiasis DNA, and the amoeba will die. So where all the metronidazole is used? So metronidazole is the drug of choice for intestinal wall disease and mainly amoebic liver abscess. So it acts mainly on the extraintestinal side, that is liver, and it also acts on the luminal amoebicides, but it has more action on the liver, extraintestinal, because it gets absorbed completely in your proximal intestine. It will not stay in your intestine. That's why it will not act in your intestine very long. So that's why if you are giving metronidazole, you should give luminal amoebicides. Okay, you should give along with luminal amoebicides. The commonly used luminal amoebicide is diloxanide furovate. It is not a very good drug for luminal amoebiasis. I told the explanation because it is completely absorbed in your intestine and only the very little amount reaches your colon. So what are the other indications you know of the metronidazole? The metronidazole is also the drug of choice for your giardiasis, trichomoniasis, bacterial vaginosis. The causative bacterium is Gardnerella vaginalis. And also pseudomembranous colitis by Clostridium difficile infection, which is commonly caused by your excessive use of third generation cephalosporins and clindamycin. So in this case, the drug used is metronidazole only. And it is also used for, it is a broad spectrum anaerobic infections. It is a drug of choice for your broad spectrum anaerobic infections like bacteroids and clostridium, like tetanus and clostridium perfringens. And it is also used as a combination therapy for your Helicobacter pylori infection in case of acid peptic disease. And what are the side effects of this metronidazole? It causes nausea, it causes metallic taste, it causes abdominal cramps, it can cause discoloration of urine, It can cause leukopenia, it can cause dizziness, it can cause seizures on high doses. It can also produce your opportunistic infections. And main side effect, clinically asked, is disulfiram like reaction if the patient is taking alcohol. So you should keep in mind, very important point is disulfiram like reaction. And also, if you are taking anticoagulants like coumarins, like warfarin, the metronidazole can potentiate the anticoagulant effect. So it can produce bleeding also. So you should be very careful in prescribing metronidazole with warfarin. Coming to other than the metronidazole, we have tinidazole, secnidazole, ornidazole, and sartranidazole. These compounds have similar efficacy and potency like your metronidazole, but they are very long acting. So the commonly prescribed drug is outside other than the metronidazole is ornidazole and tinidazole. It is available in your clinical practice. And if you talk about only the sartranidazole, it is very safe comparing to the metronidazole because of it is devoid of your metallic taste. It is devoid of neurological adverse effects as well as the disulfiram like reactions. So this will finish this class nitramidazole, and we can discuss other drugs on next day. Thank you for your attention.